A Bloomington-based rape crisis center's bid for shared sales tax dollars reserved for mental health will go to the McLean County Board for a vote on Thursday. This despite questions surrounding the request for $100,000 in stopgap funds. That includes whether the request should have been brought to the county in the first place, as WGLT's Melissa Ellen explains.
The County Board's Executive Committee on Monday unanimously approved the Bloomington-based Rape Crisis Center YWCA Stepping Stones request for funds to help bring down the client wait list. The county's Behavioral Health Advisory Board approved the proposal last Friday, but members at both meetings expressed a need for clarity on procedures for funding applications going forward. Some disagreed with how YWCA presented the request to the county. Others thought YWCA shouldn't be eligible for the funds in question, which are dedicated to fulfilling objectives in the County Mental Health Action Plan, first drafted in 2016. YWCA McLean County CEO and President Liz German says the organization was encouraged by multiple county board members to apply for the notice of funding opportunity in December. It was also the only applicant. McLean County Board Chair Catherine Metzger characterized the situation during the meeting as YWCA, quote, reaching in for help from the county. She added that it was, quote, fine and, quote, appropriate, but that the county was not the one to determine sexual assault services as a need. While discussions at BHCC and the executive committee were mired by questions about protocol and procedure, German told WGLT that she's optimistic the county will approve.
I don't foresee people's vote on Thursday being about the process because ultimately the need is there, and that's what we're really supposed to be focusing on.
Stepping Stones has had a lengthy wait list since it lost federal funding several months ago. It previously relied on the money, and it was gifted annually. At one point, the organization's wait list totaled 65 people. German said during the meeting that it caused them to lose clients.
We saw a 70% attrition rate due to clients being put on the waiting list, meaning when we started to call clients, many were no longer in a place to start services due to the wait.
Multiple community members spoke on behalf of Stepping Stones during public comment, including representatives from Bloomington Normal Hospitals. Bloomington Police Sergeant Kyle Nauer says the department relies on staff at Stepping Stones to provide the support that police are not equipped to provide.
So when we have a sexual assault survivor, we need someone who sees it through their eyes, who can understand and empathize with what they go through and can talk to them about it that way, because most of the police officers don't understand that world.
Nauers added that some in the department credit the uptick police have seen in sexual violence reports to Stepping Stones.
We're not seeing more sexual assaults, we're seeing more people reporting sexual assaults, which is what we're wanting.
McLean County Board member Susan Schaefer is on the executive committee and the Behavioral Health Coordinating Council. She expressed concern about the grant, reiterating comments she'd made at the recent behavioral health meeting. This included concerns that other organizations in the county will start asking for these funds.
It has nothing to do with the program, the agency, or anything like that, and what they do, because I think that they obviously do a phenomenal job. But it's more about others that had come to me in the community that said, how do I get in line?
Schaefer voted against the proposal when it was heard at the county's Behavioral Health Coordinating Council, but Schaefer said she was supporting it at the executive committee because the county's procedures were unclear.
I believe that to move forward and to make the process better, this can be a learning experience, I think, for BHCC.
There is nothing directly disqualifying Stepping Stones from receiving funds, as the center's mission to help sexual assault survivors in crisis aligns with the county's mental health action plan. However, this would be the first time funds from this shared sales tax are used to support an existing program. Prior spending of these dollars was on new programming. Bloomington City Council member Donna Bolin voted against the grant as a Behavioral Health Coordinating Council member. In an interview with WGLT, Bolin says she voted no because she questions whether the local tax dollars should be used to replace federal funding.
And personally, I do not believe it is. And I would say the same thing regardless of which group came forward and asked.
County Board Executive Committee members Chuck Erickson and William Friedrich said during the meeting that they had questions stemming from this discussion. Neither responded immediately for comment about what those questions might be. Again, the full county board will vote on this issue Thursday. I'm Melissa Ellen.
McLean County's Behavioral Health Coordinating Council is currently on hiatus. County Board Chair Catherine Metzger has suspended its quarterly meetings indefinitely. She says the group has not been fulfilling its mission. We'll have more details on that tomorrow on Sound Ideas. Melissa Ellen covers mental health as a Report for America Corps member. Report for America places journalists in local newsrooms across the nation to cover underreported topics.
Support for WGLT mental health coverage comes from Report for America and Chestnut Health Systems, caring for the community's physical and mental health and celebrating 50 years of service.